Hello everyone. Welcome to this informative session. I just want to double check if my audio is okay. Can you hear me fine?
Yes, can hear you.
Okay, wonderful. Thank you for the opportunity to be with us today. And the reason, the purpose of today's session is to share with all of you about this fantastic program. So we are working along with the Royce Dental Academy in Singapore to bring this program together. And of course, I mean, dental sleep medicine, we know is a field that is growing very fast everywhere. And, this is an opportunity to get a high quality program closer to your home, closer to your area where you live, and being able to learn from a group of a very strong speakers. So just to get an idea about today's session, so I see some familiar names from different countries. Do you mind if you type on the chat, just type briefly from where are you joining? What country are you joining? I see some participants from Singapore, Japan, the Philippines, and India. So we just want to know a little bit more about you. And of course, we will we will follow up with all of you after this session, just to make sure that we all have the opportunity to understand and to see if there is anything else that we can do for to share this fantastic program with you. Happy to see Dr. Kiyo from Japan. Thank you. I know you have taken several courses with us in the past in the United States, in Singapore in the past, Malaysia. So happy that this is a continual learning. It's a long life, lifelong learning. And I'm happy that you are with us. And of course, meeting new participants, new colleagues from different people. So we can see here Singapore, Philippines, Japan, and Hong Kong. Fantastic. Okay, so we want to take the best of this short session. We wanted to inform about the content, about the academic framework that we are putting together in this program. So I'm going to share a screen so we can review some standard information. And towards the end, so we will have the opportunity to answer questions related to the program, related to the academic framework, and the way you will be able to join us on this mastery program. So I'm going to share my screen right now. Um, if at some point you see or you don't see my slide or anything wrong with the audio, just let me know. You can open the microphone and we'll fix it right away. So while I have this slide on my computer, so it's hard to see my the chat room, but feel free to open the microphone. And we are here for you in the next 30-40 minutes. So we will go over this overview of the field of dental sleep medicine, and we will answer questions. So first of all, so we know that the field of dental sleep medicine is a fast growing field. So the name of dental sleep medicine basically is the way that dentists are getting involved in the management of sleep disorders and airway disorders. Sleep and airway certainly is a group of conditions that are affecting a lot of people worldwide. And the treatment options that we had for these conditions, obstructive sleep apnea, snoring, so certainly is something that we as a dentist can identify in the dental patients. We can offer different treatment options that certainly we can learn during this program. And well, I mean, Dental Sleep Mastery Program. So what is about this program? So what make this program different? Well, the Mastery Program is the academic structure that we implement into the modules, into each session that we provide to all of you. So the framework or the design of each of these sessions is carefully selected based on strong academic background, evidence-based, the most updated literature and evidence about this field. So dental sleep medicine is an area that is here to stay. So the opportunity of offering this program, of putting together this program, so it's very unique. Why? Because number one, so we have a very strong collaboration with Royce Dental Academy. Royce Dental Academy is located in Singapore. It's a group of very enthusiastic colleagues that are supporting, to develop and to bring and organize all the logistics of this program. And as we know, Singapore geographically is an excellent area to travel, as you see. So we have colleagues, dentists with interest from Japan, Philippines, India, Hong Kong. So it's geographically it's a good place, accessible to fly, a short fly, and spend the time for this program. So sleep is something that everybody needs. So we know that in order to be able to function during the day, in order to learn and to perform all the different activities, so we need a specific number of hours of sleep to fulfill a need, to fulfill some specific functions. Each time of sleep, each stage of sleep, it has some characteristics and some particular function that we need in order to perform during the day and in order for all our organs to function well. So what happens when we do not have a good night's sleep? As we see on this slide, certainly the effect of a sleep deprivation, the effect of not having a good night's sleep, it really goes like very bad over time. So there are some changes at the level of the brain, the muscle, cardiovascular situation. So in overall, not having a good night's sleep, it can result very similar to the signs and symptoms of different sleep disorders. And here we are not even talking about obstructive sleep apnea or any other sleep disorder yet. So it's just about the fact that we do not get enough hours of sleep. Now, the reason that we see a lot of interest, a lot of courses going on around the globe is related to the big problem that we have is a public health problem related to sleep disorders and sleep deprivation. And this is nothing new. I mean, when we look into this publication since 2006, there's been a lot of recommendations about the need to incorporate the teaching, the learning about this field in the medical academies and the dental schools, and of course into developing these continuing education programs. So
Outside very noisy. Go to your bed. You're warming up my bed. Yeah. Okay, go to your bed, please. You're on my bed. You can warm up the bed. I'll say very hot.
okay, sorry about that. Something went wrong with the audio, so I'm going to play the presentation one more time. Okay, so moving along with this info. So the reason that that we are developing these programs is to help with this global prevalence of obstructive sleep apnea. So approximately 1 billion of adults suffer from this condition worldwide. And we see here is a big problem, but at the same time, it's a big opportunity for everybody in the medical and the dental field to join this effort and find different treatment options, to treat or to help these patients. In this video, I know, the sound of snoring, the sound of this effort to breathe is very intense, is very loud. And this is actually, the events, the respiratory events that happen in a patient with obstructive sleep apnea. So let me play the video for about 5 seconds so you can hear the sound of the apnea event and suddenly this kind of awakening, this effort to breathe again. So this happened several times during the night. And this is when the person, number one, stopped breathing, so the airway gets collapsed, and the effect of obstructive sleep apnea, it tends to develop. So in this animation, we can see the structure of the upper airway, the base of the tongue, the soft palate, and how the airway it become narrow, 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 developing first into snoring sound, very loud sound, and eventually getting the upper airway fully blocked. And so that's when the effort to breathe is going to occur. So the person tend to wake up with a very loud sound, and this is going to repeat over and over and over and over again during the night. And that's how we identified the severity of this condition. It could be mild sleep apnea, moderate sleep apnea, or severe sleep apnea. So this cartoon, probably you've seen this cartoon in many places. It comes from a very strong, very nice publication from Dr. Ecker and colleagues, where it shows the different therapies depending of the pathophysiology of the obstructive sleep apnea, depending on what is causing the blockage of the upper airway. So there are different treatment options related to mandibular advancement devices, CPAP, surgery, weight loss, positional therapy, and all this is related to identifying the candidates, identifying the patient, depending on what is going to be more appropriate for each condition. There are some anatomical obstructions, therapy related to anatomical issues, muscle function or dysfunction, loop gain, and arousal threshold. This is something that we will review in great detail during the program. And here there are the options, that we offer to patients at this time, starting from the use of the CPAP, surgical procedures, positional therapy, and of course, the mandibular advancement devices or oral appliance therapy. This oral appliance therapy, it has been, like in a very strong evolution based on, what we know about the efficacy, evidence-based. So dental sleep medicine is pretty much the intersection of dentistry and sleep medicine. So this is a strong collaboration that we had with ENTs, with the neurologists and sleep specialists is important, and this is emphasized on the recent publication. I mean, there is some of the publication regarding the evolving field of dental sleep medicine and the way the research, clinical expertise have been implemented in a strong way of helping to move this field forward. And here we can see a couple of clinical practice guidelines, one coming from the medical field, from the American Academy of Sleep Medicine, and the other one coming from the American Academy of Dental Sleep Medicine. So medical and dental fields, working together towards offering some guidelines, some recommendations about the management of this condition from the dental standpoint. And here, well, we can see the level of evidence, the recommendations, and in general, dental sleep medicine, even though we utilize oral appliance as a tool to keep the airway open, to reduce the obstructive sleep apnea and snoring. So dental sleep medicine certainly concerned to the study of the oral and maxillofacial causes and consequences of sleep-related problems. So, doing the examination of the upper airway, the oropharyngeal area, it can help us to identify some other conditions, besides snoring and obstructive sleep apnea. There are some additional areas that we include in the teaching and practice of dental sleep medicine, like like the list that we can see in this from this publication. So the point is that the management of sleep disorders, it requires a strong collaborative approach, a multidisciplinary approach, including dentistry, pediatrics, nutriologists, physical therapy, neurology, and a list of different fields that is going to help. Each area is going to provide some particular benefits to the management of this patient. And of course, I mean, oral appliances, there are different designs and different options that we can see in the market at this point. And every time, there are more companies specializing in the fabrication and design of these devices coming to different areas. And fortunately, there are more options that we can utilize to be able to help patients with the sleep apnea. Here is basically a two-dimensional view of the upper airway and the way that the mandibular advancement device is going to modify the position of the hyoid bone, is going to increase the space at the level of the soft palate and at the level of the base of the tongue. It's simple an animation showing the effect of these devices. So to be able to reach that particular position, mandibular position, so there are different techniques that have been developed to identify what is the most appropriate mandibular position that helps to reduce or to eliminate that particular obstruction or obstructive sleep apnea. So here in this picture, so we can see one of the latest clinical approaches to identify the therapeutic mandibular position through the DICE technique or drug-induced sleep endoscopy. It's a technique that is evolving, it's very innovative, and there are some promising results that we can see in during if approaching this particular technique. So we understand that the upper airway, is a three-dimensional view, and we need to assess, the best way to identify this particular um, amount of advancement in millimeters, in percentage of advancement, and we will review all the different techniques. So now it's important to know that compared to CPAP therapy, PAP therapy or positive airway pressure therapy, so we understand that is the gold standard, it's 100% effective. However, there are a lot of people, a lot of patients that for different reasons, they can't utilize the CPAP, they cannot tolerate the high air pressure. So for those patients, that's when it comes the option, the alternative option, the alternative therapies like oral appliance. And there is plenty of evidence, doing the comparison of treatment with CPAP and oral appliance and the benefit that we are providing with this particular therapy. So the most recent publication showing the improvement or the effect of mandibular advancement device compared to CPAP in helping patients to reduce blood pressure. So this is one of the latest articles. I mean, and I think, dental sleep medicine, like any other field in dentistry or medical, so we need to implement our clinical practice on evidence-based clinical practice. And fortunately, right now, the evolving field of dental sleep medicine, the use of oral appliance therapy in this patient, we're seeing very promising results in the strong research implemented by groups in Australia, in the United States, in Europe, so are helping to develop this field. So probably many of you are already familiar with organizations, dental sleep societies that have developed, and this is very helpful because they developed some guidelines, some different recommendations. So one of them is the American Academy of Dental Sleep Medicine. At the same time, the newly developed World Endofacial Sleep Society, which it implements meetings along with the World Sleep Society. The most recent one actually was in Singapore a couple of months ago. It was a nice way to show how this collaboration between the dental field and the medical field is needed. And well, I mean, just for the purpose of today's session, so let's take a look into the clinical protocol for dental management of obstructive sleep apnea. Remember, the purpose of today's session is an informative session where, I mean, we want to share with you the importance of for dental sleep mastery program coming to Singapore, and the reasons why we want to develop this program in that region and for the opportunity for all of you to join us. So the clinical protocol that we will include in the teaching of this mastery program is a protocol that have been implemented in different institutions. As you are aware, I mean, the teaching and practice of dental sleep it's been very strong though. So the academic background that I have, along with many of my colleagues that will participate in this program, is very intense. And so it's been over 25 years of clinical and academic experience that we bring to all of you in this program. And let's talk about how we are going to implement oral appliance therapy, how we're going to help patients in the field of dental sleep medicine. So the protocol that we follow, that we teach, and that we will stratify in great detail during the program, it includes these areas, starting from screening, clinical history, finishing up with management of side effects, and very important, the way that we will follow up patients in the long term. Obstructive sleep apnea patients, I mean, is somebody that will stay with you in your practice for a long time. And we need to understand, the way we are going to implement this appointment, these follow-up appointments, what we need to include into the examination, the updates on the clinical history, and so on. But let's start with these steps, okay? So for the next 10 minutes, so let's take a look into the clinical protocol. So the first step is to assess signs and symptoms of obstructive sleep apnea. And you can do all these in your existing dental patients, like somebody going for an implant, for, dental cleaning. So that is the opportunity to implement these questionnaires, so to do the assessment of daytime and nighttime symptoms. For that purpose, we utilize and we recommend a couple of screening questionnaires. The first one is the Edwards Sleepiness Scale, and the second one is the Stud-Bank questionnaire. So this questionnaire has been validated for the purpose of assessment of excessive daytime sleepiness and to identify patients with upper airway collapsibility, obstructive sleep apnea. So the collaboration and diagnosis, the referral and diagnosis is a must. It's very important to identify a local ENT, a local sleep specialist, a local sleep laboratory that you will start that collaboration, that communication, and eventually grow that network of referral patients in a mutual direction. So referring, identifying patients, for diagnosis is important. And there are different options. I mean, we had polysomnography, polygraphy, like home sleep apnea test devices, or the polysomnography, where the patient spend the night in the hospital for a more extended version of a sleep test. So, I mean, I think we will include all these options and for participants to understand the difference between having a sleep study and hospital sleep study and laboratory sleep study or polysomnogram, and also the use and limitations of the home sleep apnea test. And we have different companies that we will join us to show the different equipment, the different option for that. So moving forward, after the diagnosis of sleep apnea, so we get into the examination, the comprehensive examination of sleep patients before starting appliance therapy. Just the standard information regarding body mass index, neck circumference, intraoral assessment, assessment of some obstruction of the nasal passage. Something very important, and we add a workshop, a hands-on, and different demonstration is related to examination. The examination of the masticatory muscles, muscles of the head, the face, the neck, all this structure, why it's important to emphasize and to include these steps of examination. I mean, as we picture the advancement of the mandible, the use of oral appliance, so the structure surrounding the airway, I mean, are going to be directly involved, okay? Muscles of the face, muscles of the head. And this is important. Why? Because side effects, moving the mandible forward, it may exacerbate some tenderness over the muscles of the face, or may exacerbate some symptoms related to the TMD, to the temporomandibular joint area. So this component, we include as part of the hands-on and workshop of the program, and understanding the muscles involved in mastication, in function, the temporomandibular joint, the assessment for pain, sounds, and function. And all these steps are important before, initiating therapy. So after completing the assessment of signs and symptoms, getting the diagnosis either from polysomnography or polygraphy, so then we complete the first few steps before moving forward into selection of oral appliances. So here we can see the four standard designs of mandibular advancement devices, adjustable devices coming from different designs from left to right. Okay. So when we look into the component, the advancement, the mechanism that allows the advancement of the mandible. So these designs have been given a particular nomenclature, like compression, bilateral traction, midline traction, and bilateral interlocking. All these designs of oral appliances are going to be reviewed in detail, showing the efficacy, the components, the way they need to be adjusted, and the place, of course, where can be fabricated for your patients. And this is part of actually very, very strong component of the of the program. And we will go over, some hands-on and workshops to identify this particular mandibular position to initiate therapy. So we will review some methods of bar registration of mandibular advancement position, like the one that we see in this video. So the group, participants come into the program. So what we do, we make small subgroups. Participants work in pairs, with colleagues, used to implement to practice with each other during the program and implement these different techniques for by registration. At the same time, we will do the implementation of digital steps. So the digital workflow, okay, digital workflow from intraoral scanning, from by registration intraoral scanning is something that we will add into the hands-on as well. So we will learn how to take this by registration utilizing intraoral scanners. So you can send the files directly to the company, and in that way you can save a significant amount of time from sending the file, receiving the appliance, and so on. So analog and digital steps are included as part of the hands-on and workshops. So then moving into the next step, remember at this point, for those of you who just joined the session, so what we're doing in this informational session, so we're reviewing the steps of the clinical protocol for oral appliance therapy for sleep apnea patients. And here again, so the four designs of oral appliances: bilateral compression, bilateral traction, mid-lag traction, and bilateral interlocking. On the upper portion is, you can see the mechanism that we need to adjust. There are different names: titration, adjustment. Is basically all these names include the advancement of the mandible, the advancement of the lower plate in a way that will increase the airway patency until we reach the therapeutic mandibular position. So what is the therapeutic mandibular position? Is the mandibular position that we achieve with these oral devices, where the patients find a resolution of signs and symptoms. Okay, so that is subjective, but objectively, so we find, or we do a comparison, to measure the efficacy. How much reduction are we giving to the patient? How much reduction on the apnea index? How many respiratory events are improving, from the apneas, hypopneas, oxygen level? So this is pretty much when we reach the therapeutic mandibular position. And I mean, it's something that we include. And for sure, this situation, for those of you who probably already are treating patients with mandibular advancement devices, with oral devices, at some point, we find this situation. So the patient will come back complaining about joint pain, maybe unilateral, maybe bilateral joint pain, face pain, tooth discomfort. So all these situations, are part of a long list of side effects that we need to understand how to manage, but also we will learn how to prevent, how to minimize these side effects. What techniques are we including, to choose the appliance design? Maybe some modifications on the oral appliance design, especially if patients already have some pre-existing TMD symptoms. If somebody already have TMJ pain, face pain, headaches, so those group of patients are the ones that we need to emphasize on the step of examination, clinical history. Why? Because for that group of patients, though, so we need to communicate very specific with the manufacturer, with the laboratory fabricating the devices, to make sure that that particular design will not make those symptoms worse. Or if in some cases, modifications of the original designs are needed to be able to manage this condition. Remember, TMD symptoms, temporomandibular disorder symptoms, obstructive sleep apnea, sleep bruxism. So all these conditions are going to coexist, okay? So you will have significant number of patients, with symptoms related to TMD, patients with a chronic history of sleep bruxism, and those patients are the ones that will be coming to see you for, management of snoring and sleep apnea. So during the program, so we include this important component, these conditions that once again are going to coexist, and we need to learn, about the sleep bruxism, temporomandibular disorders, and the way we will incorporate different techniques for examination, for management, even though the program is focusing on sleep apnea patients, snoring, but we need to be aware of these additional areas, TMD, sleep bruxism, so we include in that. And finally, after including the understanding of all different steps into the clinical protocol, so we need to document all this information and implement that information into the follow-up appointments. This is the standard clinical notes that we follow from subjective, objective assessment and plan of care, or commonly known in the medical field as the subclinical notes. So part of the developing of this mastery program is basically to provide some particular templates, okay, some PDFs, some templates that you can adapt to the clinical practice. But these templates include the standard sections that we're reviewing here right now, and are extremely helpful. They're very helpful for those clinicians, those participants taking our program. Why? Because it's a very strong guidance, for this section that we need to include from clinical history, from examination, what areas, the way that we need to type the clinical notes, and some templates that we utilize to share with the referring physician, with the sleep laboratory. So all those, important, very important tools, so are shared with you, are included in the program, and just to make the whole process, like a very straight, streamline, like very effective, make it things easier for participants, and for the participants to get, what we normally include in the daily management of sleep apnea patients. And basically, like showing and sharing the clinical protocol, so it gives you like a broader understanding, okay, of what is needed from the assessment of signs and symptoms, examination, the collaboration with different fields, very important. And that's the reason that we add a multidisciplinary team of speakers, of clinicians in the program. And that's how the mastery program, it was developed. So once again, the mastery program, it includes a very strong academic framework, very strong academic background on all the modules. So this is a 3 modules program that's going to be offering in Singapore. So the total number of hours that we offer combining the 3 modules is 65, okay? So there are 2 modules that include the on-site participation. So those 2 on-site modules is a total of 40 learning hours. in addition to the online modules that we implement for all of you. So these are the dates. So the program starts in January. Module 1 is on site, Module 2 online, and the last module, once again, on site on May 22nd and 23rd, 2026. So the total learning hours, the one that we spend in the classroom and online, are 65. And this is the list, the team of speakers that are going to join us in the program. And as we look into the speaker's background, so you can see that the area, the expertise is different from each of them, but we all together, okay, we will come into this approach of understanding the clinical protocols, understanding the best clinical management of sleep apnea, understanding the need or referrals to the ENT, to the neurologist, having a comprehensive review of pediatric sleep medicine, orofacial myology, okay, or myofunctional therapy, the importance of orthodontics and dental sleep medicine, okay, very important, and something that we include is understanding the scientific literature, okay. So you will have access to an educational platform where we upload articles, presentations that we include in the program, and other educational material that you can review at your own pace during each module. And like many people, they ask us, okay, so what is different from this program to the existing one? I mean, so we can list it and we are here. I mean, as simple as the time that we have spent in the field, teaching and practice, which has been over 25 years of academic and clinical experience. So that experience, those 25 years of experience, so now is translated into the development of this program. So the component of the mastery program Singapore, it will go into different sections, including what we see here, clinical skills in dental sleep medicine, okay, examination of the sleep apnea patients, hands-on into the bar registration, feeding and adjustment of oral devices, diagnostic capabilities, understanding the component of the sleep study or polysomnography, understanding the use and limitation of home sleep apnea testing, develop this particular treatment planning and management, like the one that we saw into the clinical protocol, okay? And also, a significant amount of reading material, something that you will follow at your own pace, but with modules, just to understand the research and evidence-based practice that it goes along with the clinical application, used with the techniques that we follow. Now, in addition to those main components, the clinical skill, the diagnostic skill, so let's take a quick look into the learning areas, okay? So the learning areas are divided into understanding of sleep physiology, medical and dental integration, the overall patient assessment, okay? Patient communication, the way that we implement different techniques for treatment acceptance, for patient to understand the benefits of therapy, of oral appliance therapy, also understanding, the different treatment modalities and the need to work in a multidisciplinary approach. So part of the curriculum, as we mentioned, as we mentioned into the beginning of this informatization, the curriculum of this mastery program has been developed based on the existing evidence, clinical evidence, but also all that research and clinical evidence, which we understand is important. So we have dissected all that information into the clinical applicability. And when we look into here from one section to another, we include the review of the upper airway anatomy, pathophysiology of sleep apnea, understanding the normal sleep, consequences of sleep deprivation. We'll go in detail into the medical history, examination and diagnosis. And number four, we talk about the importance of sleep bruxism and temporomandibular disorders. Pathophysiology, signs and symptoms, different treatment options that you can incorporate as part of the management of sleep apnea patients. And once again, because these sleep apnea patients, many of them are going to complain, or you are going to identify that they have some TMD component, and this condition, once again, they coexist, and the learning about this part is included in the program. And then continue into the curriculum content, so we take a look, we review the different sleep disorders associated with obstructive sleep apnea. And then we include a section about pediatric sleep apnea. Even though the mastery program, the focus is in the management of adult sleep apnea patients, the understanding of pediatric is included. Dr. Uma Kakadwa is one of our speakers that will include the teaching of pediatric sleep. And then, the overall multidisciplinary management of sleep apnea. So oral appliance is a strong component, but understanding the other treatment modalities, for better communication with the medical group is absolutely important. So that's why we include the different options related to sleep surgery, positional therapy, positive airway pressure, and of course, the strong component of mandibular advancement devices, adjunctive therapies, and interpretation of scientific literature. So you will have access to our educational platform, articles, presentations, so something that you will get access at your own pace during the program. So just to finalize the next 5 minutes. So what is, again, so what makes us different? So what are you learn different from any other program? We put emphasis into the practical skills, okay, the hands-on, the demonstrations that we implement during the on-site modules. We follow up with all of you during the online modules. We implement evidence-based clinical practice and something very unique. And it's related to mentorship, okay? So what is a mentorship? So it's the ability to have some assigned faculty members to follow up with each of you. And personally, I give a strong communication with each participant to guide participant in the learning process, at some point to guide them towards, the clinical component, the examination, and so on. So in addition of having the experience of being all together during the modules, so the individualized teaching, okay, mentorship, communication, emails, phone call, text message. So that really is what makes the program different, unique, and the ability for each of you to know and understand that there is somebody there that will answer your message, will answer your phone call, and will answer your questions as part of this program. Clinical cases So it's strongly recommended for participants, to develop clinical cases to present to the group. Either, a clinical case that you are going to just start, some clinical case maybe that you completed, or some clinical cases that probably you had some complexity. So we'll review it all together. And at the end, is the expert learning, the team that we bring to all of you from different disciplines, okay? Pediatric, orthodontics, myofunctional therapy, oral appliance therapy, dental sleep medicine. So we are here for all of you. So having said that, so I think this is the informational webinar that we had put together for all of you. We want to thank you for attending this session today. So the program start in January. Singapore, the venue is a beautiful location. So we had plenty of natural light to to keep us strong and awake during the program. And reaching this point of the presentation, we would like to know if any of you have any particular questions. And for the purpose and, in appreciation of the time that you have taken on join us today, so I have communicated with our local collaborator with Royce Dental Academy, and we agree to offer a special discount and a special tuition fee registration for all of you who attended today's session. But before, disclosing that amount, we would like to know if you have any questions. Either you can type it on the chat, you can feel free to open the microphone, and we can go over that particular question with all of you. So I hope today's webinar has been informative to all of you to understanding, the component of our mastery program and the importance of getting involved into the learning about dental sleep medicine and the way that you can help a lot of patients. So we know the prevalence of sleep apnea is very high. It's almost 1 billion worldwide. And given that number of people suffering from this condition, something we can see the opportunity for dentists, for the dental field to get involved and to help those patients. All right, so while we wait for any questions, so the tuition fee that we have implemented from this program, as you see, is a very, very strong academic component, clinical applicability. For those of you who attended today's informative webinar, so we have a reduced tuition fee, a discount of 1,000 USD. So the regular fee, as you see on the upper portion, included an early registration fee. So now we will follow, okay, we will send you some additional information and the list of participants from today's session. So we will have this opportunity for a reduced tuition fee, a discount of 1,000 USD. So the program include the three modules, two on-site modules, one online modules. So we will do a follow-up with each participant between modules, access to our educational platform where you will find articles, presentations, and so on. I would like to invite our team from Royce Dental Academy, if you're available, and share with participants any additional information that you would like to communicate with them, either Wendy or any of the team Royce Dental Academy. So let me bring you here. Hello, Wendy.
Hello. First of all, thank you so much for your amazing presentation, Dr. Korea. Hi everyone, I'm Wendy from Royce Dental Academy. So it's great to meet all of you and thank you for joining us tonight for the webinar. So actually, just a bit of background. Royce Dental Academy is the education arm of Royce Dental Group. So it's one of the largest dental groups in Singapore at the moment. And our mission is to support the professional growth of dental practitioners through high quality training and education. And we offer a wide range of dental courses throughout the year. And we're really delighted to be collaborating with the Oral-Facial Sleep Consortium Global to bring you an exceptional course led by Dr. Korea, who is a highly respected expert in dental sleep medicine. And we're also excited to partner with Dentsply Sirona, who will be hosting the course at their beautiful office at GoCo Tower. So usually dentists actually need to fly all the way to Tufts University in Boston to learn from Dr. Korea. So it's actually really amazing that we're able to offer his course in Singapore. So really, this is a course you don't want to miss. As you can see from Dr. Korea's presentation, it's going to be very comprehensive. And Dr. Korea and his team, I know, have put a lot of effort into creating the best program possible for you. So we really hope you'll join us for an amazing time of learning. And if you'd like any extra information, you can always visit our website, rda.com.sg. We've got the flyer of the course and everything else you need to know about the course. But also, as Dr. Korea said, he'll be following up as well to give you further information. But really hope to see you all there.
Thank you so much, Wendy. Thank you all. So,
No
as we
worries.
are, respectful of your time, so we keep this informative webinar to 1 hour, and we are finishing right on time. So that means I say a lot. So because I think having this schedule, and is where you are going to start when you finish. So we want to thank you all for spending this particular hour with us, learning more about our mastery program, and we will follow up with the next few days with some more information, some more details, and we truly hope to see you in Singapore in January and take the opportunity of this valuable program, bringing to all of you closer to your home. Thank you all. Have a wonderful evening in Asia, and we'll be in touch over the next few days. Thank you, Royce Dental Academy. Thank you,
Thank
Wendy.
you.
Thank you, Dr. Kiyoe from Japan. Thank you, Philippines, Hong Kong, Malaysia, Singapore, for joining us today. Have a wonderful evening.